Do you know that the most terrifying thing destroying the lives of millions of people around the world isn't a physical illness, but an invisible enemy in the mind? Depression isn't just sadness. It's the leading cause of disability globally. In the US alone, nearly 10% of adults are struggling with it. That means for every 10 people you meet, at least one is fighting a battle you can't see. Do you think feeling down or sad is depression? That's completely wrong. Most people feel down at some point in their lives. A bad grade, losing a job, an argument, or even a gloomy rainy day can make you feel sad. Sometimes there's no reason at all. The feeling just appears. But then circumstances change and those sad feelings go away. That's not depression. Clinical depression is a completely different story. It is a medical disorder, a real disease of the brain, and it won't just disappear because you want it to. It's persistent, lasting for at least 2 consecutive weeks, and it seriously interferes with a person's ability to work, play, or love. And here's what's terrifying. Depression has a countless number of different symptoms. From a depressed mood, loss of interest in things you once loved, changes in appetite, feeling worthless or excessively guilty, sleeping too much or too little, difficulty concentrating, restlessness or sluggishness, loss of energy, to recurrent suicidal thoughts. If you have at least 5 of these symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. So why is depression considered the leading cause of disability globally? Do you think a disability is only a physical impairment? No, a disability can be invisible, and depression causes some serious types of disability that many people don't realize. Social disability. Depression can cause a person to gradually lose the ability to maintain relationships. Fear, anxiety, and feelings of worthlessness cause them to isolate themselves, staying away from friends and family. Occupational disability. Depression severely reduces the ability to concentrate, memory, and work motivation. This makes it difficult for a person to complete tasks, leading to reduced productivity and potential job loss. Personal disability. Most sadly, depression can even leave a person with insufficient energy to perform basic daily activities, such as showering, eating, or sleeping normally. This explains why a person with depression can look completely normal on the outside, but inside, they are struggling with invisible obstacles that paralyze their life. But that's just the tip of the iceberg. The truth about depression is far more horrifying. Research shows that depression isn't just behavioral or emotional symptoms. It has clear physical manifestations inside your brain. Scientists have found astonishing changes that can be seen with the naked eye through tools like an MRI or X-ray. These changes include the shrinking of the frontal lobe and the hippocampus. This is a terrifying secret. The frontal lobe is responsible for planning, decision-making, and emotional control. The hippocampus is the center of memory and learning. The shrinking of these areas may explain why people with depression have a hard time making decisions, find it difficult to concentrate, and often have excessive feelings of guilt. But that's only what we can see. The real secret lies at the microscopic level. Depression is linked to a few key factors: neurotransmitter abnormalities, especially serotonin, norepinephrine, and dopamine. These are your brain's happiness molecules. When their levels are deficient or their transmission is abnormal, you feel hopeless, lose motivation, and no longer have interest in the things you once loved. But the crazy thing is, over 90% of the body's serotonin is produced in the gut. This explains why gut health is directly linked to mood. Circadian rhythm disruption. Depression changes your sleep cycle, making you sleep too much or too little. Over 80% of people with depression have sleep problems. This creates a vicious cycle. The less you sleep, the worse you feel. Hormonal imbalance. Depression is often accompanied by abnormally high levels of cortisol, the stress hormone, and a thyroid hormone imbalance. This explains why people with depression always feel tired and exhausted even when they're not doing anything. But that's nothing compared to the impact of the modern world. According to a study from the World Health Organization, WHO, depression is the leading cause of illness and disability among adolescents and young adults globally. One of the biggest culprits is social media. Studies show that nearly 60% of social media users spend 2 to 3 hours a day scrolling, creating a huge amount of dopamine, which makes normal activities boring and contributes to depression. And the most heartbreaking thing is, even though depression is a treatable illness, a painful truth still exists. According to the U.S. National Institute of Mental Health, a person suffering from depression takes an average of over 10 years to seek help. Millions of people are still struggling in the dark because of stigma and shame. But the good news is, there are many effective treatment methods. Medication and psychotherapy complement each other to boost brain chemicals, helping patients regain their balance. In more severe cases, electroconvulsive therapy also proves to be very useful. And now, scientists are continuing to research other promising methods like therapies using ketamine and psychedelics, which are showing rapid and surprising effectiveness in treating cases of treatment-resistant depression. So, if you know someone who is struggling with depression, gently encourage them to seek these options. You can even offer to help them with specific things like finding a list of therapists in the area, or putting together a list of questions to ask a doctor. For someone with depression, these first steps can feel like an insurmountable mountain. If they feel guilty or ashamed, point out that depression is a medical condition just like asthma or diabetes. It's not a character flaw, and they can't get over it on their own, just as they can't heal a broken arm on their own. But the last thing is even more shocking. You might be afraid to ask a person with depression about suicidal thoughts. Most people believe that asking that will give them the idea to commit suicide. But research has proven the opposite. Asking about suicidal thoughts actually reduces their risk of suicide. Open conversations about mental health help to eliminate stigma and make it easier for people to seek help. I personally believe that talking openly about depression is the only way to help those who are suffering in the dark. And the more people who seek help, the more scientists will understand the disease, and the better the treatments will become. Do you agree that we should talk more about depression? Comment below. And don't forget to like and subscribe, because the next video will have more interesting knowledge about life explained simply.